for it, ride for it. I'ma organize for it, stay up in the night and in the morning I'ma rise for it, heart for it, mind for it, ears for it, eyes for it, peace and a place on this earth for me and mine for it, work for it, ride for it. I'ma organize for it, stay up in the night and in the morning I'ma rise for it, heart for it, mind for it, ears for it, eyes for it, peace and a place on this earth for me and mine for it.
Hey, thanks for tuning in to the Money, Power, Land, Solidarity podcast. We are excited today to be covering a live story of struggle here in the Twin Cities. We're here with Cliff Willmeng, who is a frontline nurse who was involved in a labor dispute in the early days of the pandemic that led to his termination from United Hospital, the parent company Allina. There was a union grievance filed, a labor grievance, and now the Minnesota Board of Nurses has taken up an investigation into this incident, and the stakes are high. This is a big, struggle in the battle for power and protection and respect for frontline workers in the healthcare industry. Cliff's nursing license is up for grabs. It's at stake in this process. So we're lucky enough to be joined by Cliff and be able to talk directly about this conflict and about the pandemic in the healthcare industry. So thanks for joining us, Cliff.
It's thanks for having me on the show, Jake.
Yeah, could you start us off just by telling us, why did you become a nurse? How long have you been working as a nurse? And, what type of nursing do you do? What do you love about being a nurse, and what's challenging about it?
Sure. I've been a nurse for about 13 years, primarily in emergency medicine. I've worked, I'm from Chicago, Illinois, really. And I started off as a nurse in the emergency room on the west sub, right there on the west side of the city there. My family and I moved to Colorado for about 10 years, where I did ER and some trauma ICU there at Denver Health, and even some stint at Kaiser Permanente, like with primary care and float pool and stuff like this. But, primarily I'm an ER nurse, about 13 years. And,
Wow.
Before I was a nurse, I was a carpenter before I was a nurse. And, I was a union activist in the Carpenters Union in Chicago. And, we fought for workplace safety there, and even ran people for local union office. And, right around the time I was getting married, it was starting to get very difficult to find construction work. I think that it had something to do with that union activity. But also I anticipated the housing bubble was going to burst. And so my in-laws are very, they've got medical folks all through their family. I had friends that were just starting nursing school. And, I wanted to start a family. So I went to nursing school at Truman College, the City Colleges of Chicago. And in terms of the profession, I love it. It's profoundly challenging for a million different reasons. You never stop learning. The people are amazing and dedicated, and, the stakes are very high. It's human lives we're entrusted with. And so it's a very challenging work environment, obviously in the ER, fast-paced, hard-hitting, critical situations that are life and death for most people. So I happen to just, for whatever reason, enjoy working in those kind of scenarios. I enjoy the staff I work with. I enjoy taking care of the patients. But it's grueling, as any nurse would tell you, and it takes a toll on yourself and your family. And it's just one of those frontliner jobs, like so many, that we're finding that during the course of this pandemic, all of those platitudes about how much nurses are loved and respected and honored and cherished by management can sometimes fall the way of just idealism. So that kind of brings us here. That's kind of where I'm at now. But I should point out that my family just moved to Minnesota, or Minneapolis in particular, about a year and a half ago. I've been employed at United Hospital since last October.
Okay, cool. Yeah, thanks for sharing that story with us. And that's my fiance, my partner, is a nurse, so I'm getting more of a window into that world. Was working as a nursing assistant for years, and at the same time going through her nursing program, and started working as a nurse. There's a lot to it. Like you said, those platitudes, they sound nice, but when you see what the health care industry looks like, the hospital industry, the insurance industry. You know, there's a big dissonance between those slogans and the workplace. And I wanted to ask, could you walk us through then that early pandemic period? I'm curious to know, like, when did you first become aware of COVID? And, you know, in the first part of last year, could you walk us through that process? And then how did the pandemic hit the hospital?
Sure. So, you know, as nurses, we know a lot of the governmental agencies, OSHA, even the Pentagon, Department of Defense, have done studies about pandemics and, like, you know, predicting that pandemics, like significant pandemics, would hit the United States for, I mean, literally decades. They've been warning about this. I was a nurse during H1N1. I was a nurse during Ebola. And, you know, in those circumstances, the Ebola one, you know, just never manifested. Where I was at in Colorado, the H1N1 thing was a bit more dangerous, and, you know, we had to take it more seriously. But, you know, you could start to develop some maybe casual attitude towards those things after those pandemics. And COVID-19 is very different. And, you know, last year, as I was working at United Hospital in St. Paul in the ER, I became a job steward in the union there in January. And, you know, we were always talking about union affairs, you know, what any job steward would do in the union to, you know, protect your coworkers and yourself. And, like, the pandemic was kind of on the distance at that point. It was really around February, March that the reality of this pandemic started to hit home and really send the entire U.S. healthcare system into a state of panic.
Yeah.
You know, the healthcare system, as you pointed out, you know, whether it calls itself a profit or not for profit, it doesn't matter. It's all run on a corporate model.
Yeah.
It's run on just-in-time production. It's run on a lean model, which means you redline your staff and you redline your supplies. It means that you don't stockpile PPE, as was suggested over and over again. And so United, we found ourselves in that exact same situation. We saw that, you know, it was crashing into New York, into Seattle. You know, we were somewhat insulated and up here in Minnesota from the coast, where it really was hitting very hard. But it threw the entire hospital organization into a crisis. And so this would really manifest with, you know, down on the ground level as disorganization, contradictory policy, declarations, different protocols, a haphazard approach to patient traffic through the ER. And, you know, this would compel us to take measures for our own safety and protection, because it was quite clear that the hospital was grossly unprepared for it. Yeah. So, you know, how did that affect me? I mean, that meant in March, to give you an illustration, by the time mid-March rolled around, I had to have a conversation with my wife about if I were to get sick and to make her sick as well, we had to discuss the potential that her and I would have to be hospitalized or intubated, or that we could even die. And what would we do with our kids? Yeah. And because we're new to Minnesota, you know, I ended up having to text my brother to make a plan so that if I got sick and my wife Mary got sick, that he would drive here from Chicago to pick up our kids so that they would have somebody to take care of them. So it was profoundly scary and anxiety producing.
Yeah, I can imagine what it was like for you, just, you know, having a partner who works in the hospital, and then every working person, you know, this was hitting us in different ways and trying to figure out what it meant for us, and still reflecting on those are really intense times. Can you talk about the issue that brought things to a head? My understanding is it was a issue over scrubs, whether or not nurses should be taking scrubs home with them from the hospital and laundering them in the home and bringing them back, or using the hospital issued scrubs that stayed in the hospital and changing when you got there. Could you just kind of talk about what was the issue at stake, and how did it come to a head in such a way that you ended up got fired?
Yeah, I didn't lose my job.
Right, exactly. There was a nurse involved job loss.
I was let go. Right. So with the scrubs, so right in the beginning, right away, we realized that we had to do stuff to protect ourselves, and that the hospital their response was not adequate, or strong enough or organized enough. And so, we do all kinds of stuff. I mean, for one, the hospital was telling us that we only had to use droplet precautions to protect ourselves from COVID-19. And droplet precautions, to people that aren't in the medical field, that means you just wear a little surgical mask, and you put on a gown and wear some gloves, because it's not, they're saying that it's not airborne. Our position was that there's no way we can make that assumption, that if we make that assumption and if we don't wear the N95 respirators and treat this as a potential airborne disease, you're going to lose your frontline healthcare workers in the first round of the pandemic.
Yeah.
So, we were wearing N95s, for a while. Like, nobody was putting even a surgical mask on in the break room where we're all huddled together in the beginning of the shift. That was something that nurses initiated. We initiated, the doctors initiated entire trainings for intubation processes that weren't right away sanctioned by Allina. So there was all these attempts, from the frontline staff to take initiative to get ahead of potential risks to our own safety and obviously to protect our patients and our family and the public health. So among those, because we were, poring over scientific study, trying to learn more about COVID-19 in those days, among those considerations that COVID-19 could be spread on surfaces.
Right.
And so, it's just common sense. If a disease can be spread on a surface, and you're working with patients that sometimes are coming in symptomatic, sometimes are coming in without any symptoms, but COVID positive.
Right.
You are, throughout your entire day, bathing in an environment that is permeated by COVID-19. And so, by the time, I could give you endless research about this, but at that time, it was a concern. It was a real concern that it could be spread on surfaces and potentially scrubs. So we have a supply of hospital-issued scrubs that are given to doctors and PAs. They're available on a rack in the ER. If we get I don't want to go into too gory details about what you can get on your scrubs in an ER during a shift, but
I bet.
if your scrubs get contaminated, you take off your scrubs and put on these hospital-issued scrubs, right? And these things are available to same-day surgeries, all that kind of stuff. And they're scrubs that you take off at the end of the day, and then they're commercially laundered. So, okay, our conclusion was that we were worried that if this stuff was getting on our scrubs, and we're taking our personal scrubs home into our house with our families to be laundered in our common, laundry, right? Like that, we're taking potentially contaminated substance out of the hospital and into the community, into our homes. Right. So thereby, it's reasonable to suggest that we could be increasing our chances for, getting this sickness and spreading it to the others. So back in May, we were starting to ask the hospital administrators if they would just provide us with these hospital scrubs, because back then they had to cancel all of March, not May. But back then they had to cancel all of the elective surgeries to make way for COVID patients. So all of the OR nurses that would normally be using these scrubs were not using them. So they were available, and we just started putting them on. And, that way we could take them off at the end of the shift and, feel at least a little more safe about potentially spreading COVID-19. So yeah. It started with myself, and you can see behind me this ridiculous backdrop is from a podcast that I do called We the Work, and it got so frustrating trying to appeal to hospital management that last March I literally made a videotape of myself calling the chief nursing officer of United Hospital. Her name is Janet Pestle, and asking her if we could have these scrubs. And she told me that infectious disease had said that they were unindicated. That's how they phrase it, unindicated, which if you read between the lines means we don't need to use them, which you can see by the video. It's still up online now, even though they told me to take it down, that I was completely confused by this did not sit right with how I understood COVID-19. So a bunch of us started wearing the scrubs, you know, and then, you know, we were also during the time, like really we were trying to, you know, gain some influence in the policy with hospital administration, with everything from, you know, patient management, traffic flow through the ER, you know, what kind of PPE would be allowed, you know, in different settings, all of this kind of stuff. And it was falling on deaf ears. We felt like we were losing our influence in how to respond to the pandemic, and that it could cost, I mean, in this case, it could cost human life. So, you know, we at that point, we started to file complaints with OSHA, which is the Governmental Safety Regulatory Agency. We obviously went to administrators left and right. We had protests, you know, and then we started to go to the media as well. And the media started picking up these stories, and it was very fast that management started to grab us, identify those of us that were wearing the hospital scrubs as a problem, and taking us into investigatory and disciplinary meetings on the basis that we were violating hospital uniform policy. So when you hear about me getting fired, the reason that they are saying is that because I was in violation of the uniform policy. It was not about patient care. It was not about absenteeism or my record of attendance in the hospital. It was that I was in violation of the uniform code. So that's the stated reason that I was fired from United at Allina.
Yeah, but it sounds like the violation of the uniform code wasn't the issue. The issue was pressing the safety and the concerns of your fellow workers and really putting pressure on the hospital to do something, you know, and like, it's not an uncommon thing for management to identify, you know, the workers who are pushing the issue, who are willing and able to speak up and trying to move them out of the workplace. Your story, it really resonates with me. I was doing very different work at the time, working for a nonprofit, and we were in the midst of a unionizing campaign, but all the dynamics you're talking about in the workplace, as far as the frontline workers, the people actually doing the work on the day-to-day basis, were in situations where we were at risk of COVID, you know what I'm saying? And know the operations of the work, so have the ideas and the know-how for what we need to do to keep each other safe, and just realizing that the farther you went up the chains to like management, and in our situation, it was the foundations, where I feel like in your situation, there's the hospital management and then the bigger company, Allina, that's even more corporate and removed from the work, you know, just slow to respond and responding from the profit motive as opposed to responding in the best interest of the workers and the work itself. So like, I feel like the health hospitals, doctors' offices, healthcare workers is where you saw that dynamic like so much more clearly. You know, like I think just the COVID situation really exposed how wasteful and unjust kind of the corporate setup is, and really how the people who make the society run and who have the answers and the know-how are usually the people actually out there doing the work. So I guess just hearing your story, I want to say salute, man. Like, I know that wasn't an easy thing to do in the midst of a really stressful season already. But it took courage, and it's important. I remember now, at the time, I was seeing your story come across my feed, and it was really giving me hope, because I was hearing stories of my friends who work in hospitals, you know, and everybody really, I was scared too for my safety, you know, for my partner's safety. I still am, you know. It's so, you know, it's a really powerful thing that you did.
Well, thank you. And it's, you know, I mean, to me, I never signed up to work at United, you know, ready to take on a major, very networked hospital corporation, you know, set to the backdrop of a 100-year pandemic hellscape. You know, but it was just, at one point, I don't know. I mean, I just had to, you know, I just felt like I was being asked to decide on some very fundamental kind of personal and ethical questions that, you know, a lot of times as nurses, we pay lip service to. But this pandemic was going to put those ideas to the test. And, you know, to me, if I'm going to, you know, take care of patients and be trusted with their lives and trusted, you know, with the lives of family members, you know, the one thing I don't want to do is harm somebody.
Yeah.
And so, you know, we all had to make a decision about whether we were going to prioritize that uniform policy, which means that I would wear my own navy blue scrubs or royal blue or navy blue scrubs, or the seal blue scrubs, which the patients don't give a crap about that. They don't even know the difference.
Yeah.
And potentially risk myself and my coworkers and my family. And at one point I just had to, I couldn't sleep. I lost like 10 pounds during that time. I was stressed. I couldn't eat it, which is no different than on the response that a lot of nurses have then and still are having now.
Yeah.
So yeah, that was really the essence of it. And you're completely right about how far removed hospital executive management is. I mean, the reason that we did not have stockpiles of PPE, the reason that we did not have stockpiles of ventilators, and that we talked about having to ration healthcare equipment to people is because a ventilator doesn't make any money unless it's connected to a person.
Right.
And so you don't stockpile ventilators and PPE unless they're making money for your business. That's why we had no PPE available when this pandemic, or very little PPE available when this pandemic hit, because it didn't make sense to the bottom line of the corporation.
Yeah.
So
it's just, I remember being infuriated, and still in, but when I learned too that like in Minnesota, we have a multi-billion-dollar medical technology industry, but when you dig into it, that doesn't mean anything for the health of Minnesotans. It's all these weird investments and insurance schemes and finance tricks, but we can't even get people masks and ventilators when they need them. It's just, if any silver lining, I don't even know if it's appropriate to speak that way, but about this whole pandemic is like, if it should be really easy for people to see how much better we can do than capitalism right now. It's like it obviously failed the test when we really needed, support, and it's possible. And just to think that the way this corporate setup leaves us with really just assed out, it's a bad situation.
Yeah, well, it was a failure that was so great and so systemic that it collapsed the largest economy in human history.
Yeah.
That's how bad this is. And, I mean, speaking about capitalist healthcare, I mean, why are all the N95 factories in Wuhan, China? I mean, they're doing that to exploit cheap Chinese labor. I mean, we're, like you're pointing out, I mean, Minnesota is the headquarters of 3M, one of the largest N95 companies in the world.
Yeah.
And yet we're using N95 masks for 5 days.
It's oh God, it's infuriating.
Again, I mean, I think we have to have a bigger conversation. Yeah, I think we have to have a much bigger conversation about what is the authority that these people are allowed to make decisions over medical facilities to begin with. I mean, to me, these hospitals and healthcare and financing, not to mention all of the other industries, the meat packing industry, the food and service industry, all of these places that are putting their frontline workers in harm's way for a buck, to make a profit. Like these industries need to be run by the frontline workers. I mean,
absolutely.
The incident command at any of these hospitals is not populated by a bunch of nurses and doctors and emergency medical technicians. It's populated by hospital administrators. So, and you can see the effect of it. It's the worst disaster in 100 years of American history. We're looking at 300,000 people that have died during the course of this. So no, this is not some small blunder. This is a systemic problem that, you're totally right. It goes right back to the corporate and capitalist healthcare scheme, which is what it is. It's a cash cow for CEOs. That's what it really is.
It is. So can you tell us now, so, things came to a point, you were fired in May, correct?
Correct. May 8th.
And then after you were fired, you filed a union grievance for your firing. And after that union grievance, now there's been a counter action against you, is my understanding. So can you just kind of let people know what's your situation now in terms of, the situation of your union grievance against Allina, this investigation by the Board of Nursing, and how can folks listening support you?
Absolutely. So I was a union steward, and for folks that don't have a lot of union experience, that just means that you're a frontline worker, but that you act as a rep for the union, enforcing the contract, defending your coworkers, that sort of thing. So, in some unions, it's almost impossible to fire stewards because they're extremely protected and, by the union itself. Well, obviously, I got fired. I got fired within the course of standing up for this workplace safety. And the union filed a grievance, and the grievance basically says, we disagree. We think that he didn't meet the just cause qualifications for being fired. We filed that right away. It's just a very long process, but that grievance goes to arbitration on January 7th and 8th of 2021.
Okay.
So it's very important. In addition to that, we anticipated this type of retaliation. And so personal sense, not through the union, litigation alleging whistleblower protection violation by Allina Health. So there's a whistleblower lawsuit against Allina as well. That's coming up. That's a ways. That's not set for trial until August 23rd.
Okay.
But in the interim time, of course, I have not been able to find work. I've never had a hard time finding a job, but for the last 6 months, I've applied at no less than 20 union facilities throughout the Twin Cities areas. I haven't even gotten an offer for a single interview. That's as a trained ER and ICU nurse during the course of a pandemic. So you can draw whatever conclusions you want out of that. And then just 2 weeks ago, I was also, I received in the mail a letter from the Minnesota Board of Nurses that this is the governmental body that oversees nursing licenses, sanctions nursing licenses, can revoke nursing licenses. And they are, there was a report obviously filed. I don't know who that report was filed by because it's anonymous, but it reads just like my personal file from Allina's HR department. So it's reasonable to at least suspect that Allina filed this, but the ramifications for this can go from nothing at all to a professional sanction and a mark on my nursing license to a revocation of my nursing license altogether. Yeah. So this is about as serious as it gets for a nurse. And, I've got 2 kids and I got a wife, and they rely on my income. They rely on the insurance that, I would make through work. So we've had to hire a lawyer to defend me from the Board of Nursing. So now we've got a grievance. We've got a whistleblower lawsuit, and we also now have to defend myself from the Board of Nursing itself. And in fact, it's an interesting kind of tidbit, but the person that sent me this letter from the Board of Nursing, as we looked into her name is Stephanie Cook. She worked as Allina management for 20 years. So the person whose autograph is on these letters, and I'm pointing over here because here's the letters themselves. She's prior Allina management. So where are we at? Just because I've been a union activist for a while and I've lived in a few different areas, I have a lot of good friends across the country. Kieran Knutson, who's the newly elected president of his CWA local, asked me just a couple weeks ago if we could start putting a campaign for my defense together. We are now doing that. The campaign has launched almost thunderously. We've got a petition going on. We put together a legal defense fund. The lawyer is going to cost me $250 an hour. And, it's just generating enormous interest on a national scale. And then, if you wanted to click the link or something like that, we just got featured in MedPage Today. The whole story got featured in MedPage Today, which is a nationally heralded medical publication. Everybody gets MedPage Today. So,
that's a good story. We'll link up to that MedPage article, and then any other ways that, we'll definitely link up to a place where people could donate and sign the petition and make sure that our listeners, are participating to the best we can.
Yeah. And then I should also point out during all of this too, we continue to organize within Minnesota Nurses Association, the union. And I was actually elected to the board of directors of MNA just a couple weeks ago. Which now, if I don't win that grievance, I will no longer be an employee of a union hospital, and I will lose my union membership, and I will lose my ability to serve on the board of directors for the 22,000 members of MNA. So you can imagine there's high stakes at this point, and it looks like a real photo finish. But yes, I could. We've got a campaign landing page. You can get general information, sign the petition, make a donation. We're certainly asking people to contact Allina with the hashtag #BringBackCliff. We've got all the contact information up on that page. And that's just frontlinersunited.net. You go there, you click Bring Back Cliff, and you'll have all of the information right there.
Hell yeah. Yeah. One thing I just wanted to say, I think there's this moment in particular, because of the things we're talking about with the pandemic, and before that it was always building, but I think there's a rise in labor militancy, a rise in class consciousness, a rise in people recognizing that we need to transform this society, and that starts on the front line level, and in our workplaces. And I just want to point to the fact, that when you hear Cliff talk about his union organizing and the implications of these moves by management to censure, it's not being paranoid to understand that is the class war. That management and the corporate side of things does their best to strip the power of the union, to knock down voices in the union, to just discourage organizing, to come down really hard to make it, so the next time somebody thinks, damn, I should really not have to wear my scrubs home and maybe get my kids and my wife sick. But look what they did to Cliff, that's a real thing. And it's just like for us to raise our class consciousness, and then we have to, on our side as workers, organize just as strong, and stick with each other and support each other. I wanted to ask you one last question, Cliff. In the organizing that you've been doing in the MNA, and just in general, what other issues are you hearing from nurses right now? What's it like to be a healthcare worker? I'm sure it's been stressful nonstop for us, but the last month or two, there's a level of intensity to the anxiety that's like similar to the spring, in our house, and even kind of new ways. So I'm just curious, what are you hearing from people?
Well, for one, this phase of the pandemic is the darkest we've seen. I mean, that's for certain. And, when you're looking at, I talk to nurses from all kinds of hospitals. I mean, I talked to one of the union reps at Children's in Minneapolis, who tells me that they're wearing N95 masks dated from 2012. The staffing is abysmal, and the patient to nurse ratio is getting thrown out the window that we were normally familiar with. And that's the amount of patients each nurse gets. So obviously the more patients every nurse gets, the harder it is to do a good job with each one of these. There's an implied intimidation of the workforce. Obviously, if you fire a steward and create a public hanging, like that, it does throw a chill into the workforce that, has the effect of keeping them quiet. But it just goes for everything. There's another huge thing, is that when nurses are getting exposed to COVID, they're being encouraged to return to work pending their 5-day COVID test.
Yes. Oh my God.
Yeah. So I know that it's, that I know workers that were told to return to work after a high risk exposure, because as we know, the viral load goes up. You might not test positive right away, but 5 days later, you can test positive. So if you go back to work for 5 days and are taking care of patients, some of them immunologically compromised, and you're COVID positive, you could give these people COVID-19 without realizing you have it. And the management was encouraging workers to do this, or to not take their 14-day quarantine. So that's, I want to say this with particular emphasis, not to leave out the fact that, the killing of George Floyd took place during all of this as well. And, we saw major uprisings here in the Twin Cities and nationally and internationally. And so the entire issue of racism as a systemic problem of the U.S. healthcare system is being raised by nurses. You know, you've got, I know in M&A, we've got a racial diversity committee that is doing like an enormous amount of lifting and work on this. We created a letter of solidarity for our nurses of color, for a bunch of white nurses, and got like hundreds of signatures on it.
I saw
So,
that.
you know, as you would, you know, you're pointing out, it's this crisis that you know is a function of capitalism, and it's being addressed by class solidarity.
Hell
And
yeah.
you know, I mean, you can read that in a book a million times, but you never really know what that is until you actually live it. And I think that's exactly where we are right now. I mean, you're seeing nurses going on strike. You're seeing, you know, wildcat actions. You're seeing frontline, you know, employees refuse to take unsafe assignments. And we know why, because we're being led into an area where we could die. So like, you know, there's a lot of risk here. And, you know, myself, when you talk about a class war, I'm a casualty in the class war. And, you know, we should make that a temporary loss, and make sure that it is harder to come after the workers than it is to give us what we need to do our job. So, you know, I'm happy to be and honored to be a part of this. I'm like floored by the amount of support we've received on a national level. You know, and unions are now starting to line up motions in support of my defense, and, you know, making a general statement about the defense of workplace, you know, frontline workers everywhere. So it's just an amazing time. And, you know, this winter is going to prove a very bumpy ride for a lot of us.
Yeah. Yeah. Well, Cliff, thank you so much for joining us. You know, salute to you, all solidarity with you and all the frontline workers. Before we jump off, you want to plug your podcast one time?
Oh, sure. Yeah, it's We Do the Work. You know, we're mainly on Facebook. You can just look up We Do the Work. We're also at wdtw.org. And yeah, we're worker-run journalism. I mean, we're just a bunch of clock-punching frontliners, and you know, that decided that we needed to have some media that was possessed by ourselves and didn't have to go through the filter of you know, whatever bullshit corporate medium there was.
Hell yeah. That's
And
awesome.
of course, again, to help the campaign, the website is frontlinersunited.net.
There you go. Check out frontlinersunited.net. Thanks for joining us, Cliff. Money, power, land, solidarity.
We need money, land, solidarity. If you're funny, stand very far away from me. We have running plans about as far as they can see to keep them coming. Bands building up the company.